Recommendations made in cancer practice guidelines affect cancer patients directly. They guide decisions for the treatment and management of the disease throughout its course. There are many benefits of involving cancer patients in their own treatment decisions, as well as in the development of guidelines. Both of these will be examined in this video, but first let's take a look at what practice guidelines are. Guidelines are systematically developed statements to assist practitioner and patient decisions about appropriate healthcare for specific clinical circumstances. In other words, cancer guidelines give recommendations based on up-to-date evidence that help doctors and patients come to an agreement about how to manage the disease. Cancer guidelines cover information about screening, prevention, diagnosis, treatment, palliative care, and survivorship. Any recommendations found in the guidelines should be based on best quality evidence. This is ensured by searching through the literature for only the most important and the best reported evidence. Guidelines are tools to support decision-making about care and to help define best practice across healthcare settings. They aim to decrease unwanted variation in practice and increase equity of care. This helps prevent unnecessarily using resources that could be better used for something else. There are steps to being able to use guidelines in practice. In general, guidelines are created and updated as needed. There could be several different reasons for this. There may be new information about a particular topic, such as a new care option. There might be a real issue with the way that a condition is being treated at present, or to align with health policy. The next step is to gather information about the question the guideline seeks to answer. This is done by systematically searching through the literature. Information is then appraised for quality, and research that is deemed relevant and of good quality is interpreted and informed in the recommendations. The guideline is then reviewed and given to healthcare providers to be put into practice. That was a quick overview of cancer practice guidelines. Now, let's take a look at the impact of involving patients in their own care. Satisfaction is greatest when patients feel included in their own care and decisions about it in the manner that they see fit. We should note that not all patients want to be included in care decisions, but it is important to determine their level of desire to be included to achieve optimal satisfaction. This happens with good communication between patient and practitioner and proper education for the patients on their own conditions. Understanding and being able to use healthcare information to make decisions is called health literacy. This concept of health literacy is important because if patients don't understand their condition, they will be unable to ask or answer important questions and the care will suffer. Encouraging patients to become more involved in their own care increases understanding of the condition and can lead to fewer visits to the hospital, better symptom management, and better general outcomes. Some tools have been created to help make it easier for patients to make difficult decisions. Two of these are patient decision aids and question prompts. They are most often used in situations where the benefits and harms of a certain clinical option are similar, and a decision is difficult to reach. Both of these tools promote patient-centered care and shared decision-making between patients and practitioners. Patient decision aids are documents created to help patients make specific decisions during their care by taking into account their values and preferences. They are meant to accompany clinical suggestions but not replace them. Like guidelines, they include up-to-date research evidence but are more readable and tailored towards patient-important topics such as benefits and harms of treatment, prognosis, and quality of life. They include frequently asked questions about decisions, what the available options are, and what outcomes the options have. They are organized in this way to help patients weigh pros and cons and organize their thoughts. Question prompts can also help patients better understand their treatment. These are documents that list a wide range of possible questions to ask during doctor's visits. They can help patients organize information into categories of what they understand and what they need to understand in order to feel comfortable with decisions. Question prompts have been found to increase the number of questions asked at a visit, reduce patient anxiety, increase recall of conversations had during a visit, and better management of symptoms. We see that there are many benefits of involving patients in their own care, but now let's consider this question. If cancer practice guidelines affects patients directly, and patients are happier, understanding, and being more involved in their own care, could patients also take part in developing guidelines? The answer is yes. Having patients involved increases the likelihood that their values and preferences are addressed properly in the recommendations. It has been found that patients want to know most about the benefits and harms of treatment, research evidence for the recommendations, and an assessment of the quality of that research. Patients are experts at knowing how it feels to deal with a condition, and this is a unique perspective that researchers might not have. Involving patients in guideline development improves guidelines by making them more readable, more accessible, and more relevant to patients. It allows patients to bring up any questions they may have had during their own treatment. This will help develop new patient-important questions for future guidelines to answer. It also helps to identify outcomes that are most important to patients and to include those in the recommendations. Finally, it can make patients feel more valued and better understood, and can improve practitioner-patient interaction. Though it is very important to have patients participate in creating guidelines, it is still uncommon. Some barriers exist that stop patients from getting involved. These include the time commitment of the development process, inaccessibility of clinics or hospitals, and the cost of transport, feeling unprepared to participate and needing better training, being worried that their ideas will not be listened to by experts, and feeling uncomfortable speaking about personal experience. On the flip side, there have been several facilitators to participating identified. These include wanting to help others, personal motivation, and wanting ongoing support and knowledge from healthcare staff. In addition, the barriers identified can be remedied by reimbursing patients for transport and other costs of involvement, allowing patients to contribute over the phone or internet, providing sufficient training to patients, and checking their understanding throughout the whole guideline development process. So how can you get involved? If you live in Ontario, you can contact Cancer Care Ontario, or CCO for short, about patient engagement opportunities. The CCO is committed to creating a person-centered care environment where the needs and preferences of patients are addressed and built into practice to encourage strong relationships between patients, families, and healthcare providers. Check out the Patient and Family Engagement website page to find volunteer opportunities and to get involved. The link is provided below. For more information on patient experience and satisfaction, visit CCO's Patient Experience page. If you live outside of Ontario, you can contact your local cancer care agency in order to find more information about getting involved. Thank you for watching.